Good morning, everyone, and welcome to the Hawaii VFC Virtual Office Hours this Tuesday, October 29, 2024, brought to you by the Disease Outbreak Control Division of the Hawaii Department of Health under the Immunization Branch, Vaccine Supply and Distribution Section. Our topic for today's webinar is vaccine orders and shipments, which will be presented by our vaccine supply logistician, Ji-Hyun Choi. Next slide, please. We do want to remind everyone of our housekeeping information before we get started. Please ensure you are muted throughout the presentation unless you are speaking. Reminder for QA team, please monitor the chat for questions you may be able to answer. And reminders for attendees, today's session is being recorded. Slides and webinar recordings will be uploaded to our VFC website. And if you haven't been receiving emails regarding VFC updates, important notices, and other VFC-related information, and would like to be added to the Hawaii VFC program email list, please email your request to Hawaii VFC at doh.hawaii.gov. And please write email list in the subject line. Next slide, please. For question, today's webinar, please use the chat to ask your questions so Hawaii VFC program subject matter experts can respond directly. And we will be answering your questions at the end of the presentation. Next slide. Here are the objectives for today's webinar. And shipment by distributors, and review how to identify and report shipment and temperature stability issues. All right, we're going to turn you over to our presenter today, Ji-Hyun.
Hi, everyone. Sorry, I was on mute. One moment. Sorry. Let me. Okay. So, thank you, Lorraine, for the warm introductions. My name is Ji-Hyun Choi. I am the vaccine supply logistician for our immunization branch here on the for the VFC program. And we will be going over the vaccine order process today. And just a quick note before we start, it was the 30th anniversary for the Vaccines for Children program this year. And it's just a really one of the most successful public health programs that have been running since for 3 decades now. And I just wanted to use this time to kind of thank everybody for participating and just highlight the important work that everyone here is doing for our children. Okay, so before we go over the exact vaccine order processes, I wanted to discuss kind of a bigger picture of how our vaccine distribution is being centralized here through our states and the CDC and the manufacturers. So it is, as you can see, we are over here where the providers are clinics here, the VFC program enrolled providers are at our state level. This is where the order process begins and where all of the kids get vaccinated. So throughout the presentation today, we'll be using this kind of as a guide to see where how the order processes process. Yes, how the order, what the order process is like. Yes. So there are different types of vaccine orders. I'm sure you guys are more than familiar with the Hawaii Immunization Registry orders. And we also use vaccine order forms for doses or vaccines that are on allocation that are unable to be on our immunization registry. So vaccines that are on that have limited availability. So some examples are the COVID-19 vaccines, the influenza vaccine, RSV nirsevimab, and our HBIG and Hep B birthing hospital doses. And some VFC order requirements. Before we process any of your orders, we first and foremost check that temperature logs of all storage units are showing the units are within range. So 2 to 8 degrees Celsius for fridge and up to negative 15 degrees Celsius for freezer. And we do monitor the submission of inventories and the number of doses on hand and the number of doses administered since last order. This is so that we can approve the order amounts that are being submitted. And lastly, we check for VAVers that are mailed to us, or we look for the EMR data exchange of the vaccine administration visit records. So as on HIR, the first thing prior to submitting an order, you would be required to submit a record inventory. So a record inventory is a snapshot of the current vaccine inventory that is currently in your unit, your storage unit. And this snapshot is required by the CDC system for approval of a vaccine order. And here is where you would enter the number of doses on hand and number of doses administered. And this is the number that we would see to approve the order amounts that are being requested. And this slightly functions differently from managed inventory. So managed inventory is a routine. It's something that the clinics would, it's your actual inventory that is for maybe like monthly, or it should be monitored. And the record inventory is a snapshot of the managed inventory. But if the managed inventory is not updated, the record inventory would function as that snapshot for the order to be approved through the CDC system. And once the record inventory is submitted, you are able to create an order through manage orders. And when you get to this manage order page, you should be checking that the vaccine shipping address, contact information, and delivery days and times are all accurate. And you could edit the delivery days and hours through this option here. And once that is confirmed, you can click create order, and there would be a small pop-up showing the vaccine delivery information to confirm that the information is accurate. You can click that and then begin your order. So on the create orders page, you would enter the number of doses you need for each product. And once the doses are entered, click submit order. Now for the vaccine order status, you can check on your manage orders page to see what the status is of your order. So first, immediately after you submit it, HIR will show that your order is pending. So pending means that the order was submitted by the office, and once DOH VFC staff is processing the order, it would go into the status would be in progress. And once the order is approved and confirmed by our staff, it would be switched to sent to CDC. And this would mean that the order information is sent to McKesson or the manufacturer through the CDC system. And this is where a lot of our orders stay in this status for a while due to maybe there are shipment delays or delays with McKesson. So this status means that your order hasn't shipped yet to your clinic office. And once the order is shipped, then it would switch to fulfilled, and that means that the order is in transit. Now, once the order is fulfilled and you've received your shipment, you are able to accept the vaccine inventory on managed transfers. Again, this fulfilled status is when the order is shipped, and you would be able to accept the vaccine inventory on managed transfers once it is in fulfilled status. But I highly recommend for you guys to wait until you receive the shipment to accept the vaccine inventory, only because you always want to cross-check that the vaccine packaging, packing list, and the HIR transfer information is all the same with your lot and expiration. And for future orders, additional vaccine orders, you're required to accept the inbound transfers to place additional orders. So it's important to make sure that you do accept the transfers, but also be wary that the lot and expiration may be different from the inbound transfer doses that you receive. So if there is an error in your lot or expiration, first you do want to accept the transfer, the inbound transfer through managed transfers, and you can edit the lot or expiration by going to manage inventory, show inventory, and then this new page pops up. You can click on the product under the trade name here that's circled, whichever product that you need to edit. And then this page would pop up where you're able to edit the lot and expiration to reflect what reflect the product that you actually did receive. It's not common, but it is it happens fairly frequent enough for providers to be aware of this process to be able to edit the vaccine inventory information. And then once you're done with editing the lot and expiration, you can go ahead and save. Now that we went through the HR vaccine order process, in the context of this this visualization, the pending orders would be over here, where jurisdictions are clinic providers are entering the orders, and in progress would be where our staff here at the Department of Health and the Hawaii State VFC staff would be working on the order to send to CDC. And once the CDC receives it, the distributor would then process the shipment, which would switch the order status to fulfilled on HIR. And then once it ships and is received, it would be accepted. So once you accept the inbound transfers, the order would switch to accepted on HIR. Now for vaccine order forms, we are accepting email and fax submissions of flu, COVID-19, RSV, nirsevimab, and breathing hospital vaccine order forms. And like the HIR vaccine orders, we do require we check for temperature log submissions and that your units are in range, and the VAVRs or the EMR data exchange, and that you entered the amount that you're ordering is it matches the number of doses you have on hand and the number of doses used. So the doses that you've administered. So we do monitor these numbers to make sure that we're not over approving or under approving for some of these orders, only because these doses, especially they're the doses that are on vaccine order forms are usually very limited, and we receive small allocations. Sometimes it's a rolling allocation system, so the amount of vaccine available changes throughout the season. So we do monitor the doses used and the doses you have on hand a lot more closely for these orders. So it's very important for clinics, in order for orders to be fulfilled in a timely manner, that this information is filled out. And in the context of the vaccine order forms, for this process, the emailed fax would be over here. So it's a little different from the HIR orders, where the clinics would be sending the orders through email and fax, and we would process it, and it would still get sent to CDC, but directly to the CDC system. And we would send a confirmation email to indicate that we did process it. And once the items ship, you guys would receive an automated email from the manufacturer or through McKesson that the item has shipped, and then you would receive the product. Now, there are several different types of vaccine shipments. First, we have McKesson, which handles all of the refrigerated VFC vaccines and the frozen Moderna vaccine shipment. Then Merck, that holds all of our varicella containing products, so frozen Varivax and Proquad, and our Pfizer shipments, which ships the refrigerated Pfizer 12-year and up, and the Pfizer 5 through 11 and Pfizer 6-month through 4-year product that ship in ultra low temperatures. And these are the three different shipments that you would receive. So the process for these are slightly different, and we can go over these a little bit. And so there has been some changes with warm and freeze temperature monitors. So McKesson still includes those temperature monitors with the packages. Merck has changed where the temperature stability is now based on transit time. So for Varivax, 40 doses or less is a 2-day transit time unless it's packed for a Monday delivery. So if it's shipped on a Thursday or Friday so that the clinic would receive on a Monday, then it would be a 4-day transit time. And if it's more than 40 doses, it would be packed for a 4-day transit time. And Proquad, it's a 1-day transit time at this time, but it may include a temperature monitoring device as well. For Pfizer, the temperature stability is also based on the shipment transit time, and the date is listed on the packing slip located on the inside flap or as a package insert. So it's very important to monitor the date that you receive the dose and the date on the packaging that shows that to make sure that your product was stored at correct temperatures. So for vaccine shipment tracking information, the email is sent to the primary coordinator from these emails below. So McKesson, Merck, and Pfizer will send a automated email once the package is shipped. And it's very important to monitor the shipment tracking information for any changes to shipment delivery. And this is important that to ensure that staff is on site to receive vaccines at the estimated delivery day or time through the shipment tracking site. And please notify us if a shipment is delayed by the courier and is being returned to sender, or if the primary coordinator did not receive the shipment tracking notification via email. Again, monitoring shipment tracking information is very important because it reduces the vaccine loss due to possible missed deliveries, or it can also speed up the troubleshooting process earlier if if the product was returned to sender or something happened within the shipment where the package was lost. So the earlier we receive this issue, the faster we can troubleshoot it. So once our staff is notified, we send the shipment issues to the manufacturer or McKesson, and then we're able to start the approval process for a replacement order. Now, receiving vaccine shipments, we ask providers to never refuse a vaccine shipment, open immediately upon delivery, check the temperature monitoring device or strips, or the shipment transit time, and inspect the packaging and the number of doses received. Compare the contents with the information on the packing slip, and then store at appropriate temperatures. If there is damage to the shipment, a shortage of vaccine, or temperature excursions, we ask that you please notify us at this email above, and be sure to take a photo for documentation purposes, and avoid disposal of shipping boxes, packaging, or packing slips and the temperature monitors until the situation is resolved, and separate the suspected vaccine from your non-infected vaccine stock, and label "do not use," and then store at appropriate temperatures until the vaccine viability is determined. For temperature excursions and for shipments arriving beyond the allowed transit time, we ask that providers contact the distributor on the same day of delivery. And these are the contact numbers, and for Merck, it's a separate inquiry form. So now they're asking us to enter the vaccine information through their website. And for Pfizer, you can contact them at their number or email. Now for VFC Pfizer shipment packing list, some providers have reported that it's difficult to distinguish between the commercial private stock shipments and the VFC shipments. To distinguish between the two, you can look at the packing slip or the label printed on the inside flap of the shipment. It would say the customer PO would start with a 4, and the sold to address shows CDC/FMO vaccines, with the Atlanta address here. So this would indicate that it's a VFC vaccine. And for more information on the Hawaii vaccine orders and delivery guide, you can, we'll share this PowerPoint as a PDF, and you can click on this link here to see a more detailed guide for our VFC vaccine orders. And that completes my presentation today. And I think the quality assurance team would would you like to go, Lauren?
Yeah. Thank you so much, G, for putting up the great and informative presentation. So for the post-webinar satisfaction survey, I just dropped the link in the chat. In the survey, we asked that you let us know what other topics you want us to talk about, or if you have a preferred date and time, and how we could improve. We would really appreciate it. Next slide, please. Anybody have any questions before we conclude today's webinar? Okay, so if you ever think of a question later on, you can send us an email. Our contact information is here. For VFC program and VFC site visits, these are the people that you can email or call. And for VFC vaccine orders, the email information and phone numbers are here as well. And today's session will be posted in our VFC website. I'll just drop the link in our chat. It will be in our VFC website under educational opportunities. So thank you so much for joining us today, and we hope you enjoy the rest of your day.
Thank you.